and friend from Cumberland Colchester talked about is the HESA, which is our health committee report. It is the 20th report, and just to give a little bit of background for folks watching at home, that the committee report to the House that the decision by the Canadian Task Force on Preventive Health Care should be immediately reversed, and breast cancer screening should be extended to women in their 40s, as this will help save lives, that the Minister of Health urged the task force to go back to the drawing board and revisit the guidelines based on the latest science, and that the Public Health Agency of Canada table to this committee the parameters given to the task force to update breast cancer screening guidelines. So this is obviously, you know, a lot of women watching, a lot of families watching have been impacted by breast cancer, and this was a very important study brought forward in Health Committee. I had the privilege to sit into the Status of Women Committee, where we also brought this forward. And just for some context for folks so they know, the Public Health Agency, so under the Liberal government, there's Public Health, and there's the Minister of Health, and then there's a Public Health Agency, designated a task force and a chair of that task force to study breast cancer. And so what they came back with, and the chair, their recommendation was that there should not be screening for women under the age of 50. Now, this, as you've just heard what I've said, this really has unanimous consent. It certainly did in Status of Women across all party lines, that this is a terrible recommendation from the task force and the chair. And it was really interesting to listen to witness after witness in the Status of Women testify against what the recommendations of the task force was. And here's the thing. So I would post these stories and I would get the feedback. I love to hear what people say. And the province, most provinces have already said screening should happen at 40 or self-screening. Like those are the provincial rules. And so then you have a federal body, sort of a bureaucratic body, a task force that's saying, no, it shouldn't be. It should be 50 and over, which is really bizarre. And so then I asked a lot of the witnesses, I said, why does it matter if the task force and the chair is saying it should be over 50, but provinces already have it at 40, or self-referral is the recommendation of the provinces, what does it matter what the task force and the chair says? And every single witness said, because it sends a message that you shouldn't get screened under 50. And that is wrong. So I want to bring you up to speed on a little bit, because the chair of the task force actually wrote an editorial during our study in Status of Women, doubling down after hearing witness after witness after witness in the Status of Women saying no. And you know, I heard my member from the NDP even agree with this. Listen, Mr. Speaker, I think everybody at home knows there's not many things that we agree on in this House when we go across the floor. But this is women's health. This is families who are dying because they're not getting screened in time, or it's not being detected that they have breast cancer. So this chair, her name is Dr. Guylaine Thériault, she wrote this article during testimony when we were hearing from every single witness to change the age of screening. And she said, the Canadian Task Force on Preventive Health Care Task Force conducted a comprehensive review on evidence of breast cancer screening. The key message, these are her words, the key message is that breast cancer screening is a personal choice and that women need the full picture so that they can decide what is right for them. That makes sense, correct? You shouldn't have to fight and beg your doctor. You should be able to advocate for what you want to do. She went on to say, the evidence did not show a clear benefit of screening for breast cancer in women, especially those aged 40 to 49. The evidence did not show. Well, let me read you some testimony from the Status of Women by experts in this field. Anna Wilkinson is a medical doctor. And I asked her these questions, and she said, here's a quote. First, regarding the expert involvement, the actual task force and working group for this had zero breast cancer experts on it. This makes no sense. Like, nothing about this makes any sense. And you know, my colleague who's a doctor whose wife survived breast cancer said it very well. Like, why are we as politicians having to stand up and tell this arm of public health agency that you got it wrong? And it's just bizarre. So I'm going to go on because there's tons of survivors, there's tons of families, and I think it is really important that this breast cancer doesn't just impact the person diagnosed, it impacts a whole community. So Kim McDonald is a patient advocate, and she said, right now, but at stage 0 or stage 1, if it's found that early, as it is often in the screening, you have about a 99% survival rate. By the time it gets to stage 4, we're talking about a 31% survival rate. These are significant numbers. We also have, I wanted to get to this other, okay. This is also Kim McDonald. She's a patient advocate and for Breast Cancer Canada. I first want to say how shocked and disappointed I was in the task force recommendation of keeping the breast cancer screening age at 50, and how heartened I am by provinces like Ontario for lowering the age of self-referral to 40. We also had Dr. Anna Wilkinson again testify, saying, my research with Statistics Canada has focused on breast cancer in women in their 40s. We found that the incidence of breast cancer in these women has increased almost 10% in recent years, and that women with access to organized breast screening programs have an earlier stage at diagnosis and significantly increased survival. Even if we use the task force and minimize mortality, benefits of only 1 death averted per 1,000 women screened over 10 years, this amounts to over 2,500 deaths of 40-year-old women. I want to go through here. I brought this up to a couple of witnesses, and I said, we literally have not heard from one witness that agreed with the task force or the chair. Not one, except the task force chair. She was the only one. And then she doubled down in this article during committee as sort of a passive-aggressive, she's right and everybody else is wrong. And so I asked, I want to come to this part where I asked Miss Althea Kiwayosh, I'm sorry if I pronounced that wrong. She's a director of Aboriginal Cancer Control. And I said, do you think this chair should resign? Like, that was one of the things, because we have to write recommendations. The point of a study in any committee is recommendations. And so when you hear all of this, like, what is going on, right? Like, do you disband the task force? Do you like, in any other world, this person would resign if this is what's happening, right? There's nobody else to agree with them. And I said, do you want to see the resignation of the task force chair? And this woman said, I don't know who he or she is, but he or she is obviously very out of touch with the topic. I'm sure there was a task force struck at one time that created residential schools, and look how well that went over. They need to be more in touch with the topic then. They need to have understanding of what's happening with the community and with people. They need to have their pulse on the hands of what community are saying and what people are saying. They're very out of touch. And I want to use my last minute, Mr. Speaker, to tell you that we need a lot of help in healthcare in this country. You know, it is one of the biggest questions I get asked. People they can't even get to a doctor. They can't even get to a doctor. We have a plan. You know, we've talked about this in terms of a policy and solution, which is called the Blue Seal program. And I know my colleague has spearheaded that tremendously to get all of the doctors that are out there driving Ubers and who are qualified to actually be able to practice medicine, so people have access to this. But this sends a bigger message, and we need to increase our access to the newest technology, thermogenics. We need to be, you know what, we need to have choice and informed consent for patients. And we need to give back the power to the women who want to be screened for breast cancer so that families don't have to bury their mothers, sisters, and daughters. Thank you, Mr. Speaker.
Questions and comments? Question commentaire, the honourable member for Nunavut.
I recently sat on another committee, the Status of Women Committee, recently and they were studying a similar study on breast cancer screening, but the topic was specifically for First Nations and Indigenous peoples screening. And one of the discussions in that committee was to make sure that there are better access and representation of Indigenous peoples. And I wonder if the member agrees that with this motion, there also needs to be assurances that the task force also focuses their work on ensuring that First Nations, Inuit, and Métis also get the breast screening that they deserve, because for them it's a lot more difficult, especially in Nunavut, where my constituents are flown to places like Ottawa, thousands of kilometers away, to have basic access to breast screening, for example.
The honourable member for Peterborough-Kawartha.
Thank you, and thank you to my colleague for the question. Yes, that study that she's referring to is the one that I was referring to in my speech about the status of women, where we were studying this task force recommendations. And Black women and Indigenous women were the research. We had multiple witnesses testify on this. The research that they were using was from the 80s. It was so outdated, and there is a disproportionate amount of women who are Black or of Indigenous that are impacted by breast cancer, but it's not reflected in the task force's recommendations. So 1,000%, again, that is what we say. Like, you need updated evidence here. And as I answered earlier, the task force chair said the evidence didn't even show a clear benefit of screening, yet she didn't nobody on the task force represented any of these groups, so it makes no sense.
Questions and comments? The honourable member for Cumberland-Colchester.
Speaker, and during my intervention, I did have an opportunity to speak about the consequences of diagnosing a late-stage breast cancer in a woman aged 40 to 49. But I wonder if my honourable colleague might like to make some comments around the intrusiveness and the loss of dignity, the loss of employment, the loss of income, and of course the consequences of treatment inside a family of a woman diagnosed at age 40 to 49 with a later stage breast cancer.
The honourable member for Peterborough-Kawartha.
Thank you. And you know, that age, 40 to 49, you know, I'm 45, and I think about, I've got aging parents, you've got children, you're trying to get your career, you're trying to pay your bills, you're trying to do all these things, and then boom, you're not well, and now you're not able to go to work or make money, or the consequences of that are devastating. And when you talk about prevention, and there was actually, I asked that question to one of my witnesses. I said, I don't understand this recommendation. Is it a money thing? Because that's the only thing I can ever find, right? Follow the money. Oh, it costs too much money to do the screening. And I don't know if I'll be able to pull it up here in my time, because it's all the witness testimony here. But I do know that one of the witnesses talked about the financial, how much money you save. I don't understand why we can't. People talk about the harm. This is by Cheryl White, breast cancer survivor. People talk about the harms of mammograms, but the only harm I can think of is the $75 cost of getting one. But the money that you would save in prevention of women who have to access medicine and not be able to go to work, and the families impacted, it doesn't make any sense. You're going to save economically. The impact would be far, far worse if you didn't get early diagnosis.
Questions and comments? Maybe a quick question or a quick comment? Resuming debate then. The honourable member for Kingston and the Islands.
Thank you very much, Mr. Speaker. I'll be splitting my time with the member from Charlottetown, and he being the